Good day, I am Pearl Angelisabal from BSN 1B, and today I will be demonstrating to you the proper donning and removing of sterile gloves open method. The purpose of this procedure is first to enable us to hold or to touch sterile objects freely without contaminating them, and to prevent the transmission of potentially infective organisms from the nurse's hands to the clients at high risk for infection. Now, following the nursing process, we will begin with the assessment of the patient first. We need to review the client's records or orders so that we can determine exactly what procedure will be performed that requires the use of the sterile gloves. Also, we need to check for the client's records or data and ask about any latex allergies. Use non-latex materials or gloves whenever it is necessary or it is possible. After doing the assessment, we will now proceed to the planning, in which we will need to think through the procedure. We will need to plan which step need to be completed before applying the sterile gloves on our hands. And also, we need to determine what are the additional supplies that is needed to perform the procedure you will be doing, and make sure that you have an available extra pack of sterile gloves with you. And then we also need to assemble the equipment, which is a package of sterile gloves. After doing the planning, we will now proceed to the implementation. First, for the preparation, we should determine the correct size of the sterile gloves we will be using. In my case, I will be using a glove or sterile glove which has a 6.5 size, as you can see. And the gloves or the sterile gloves you will be using must not be tight, but it must be snug. Also, we need to ensure the sterility of the package of the gloves. Check for the expiration date, and the one I will be using will expire on June, or the month of June, year 2025. It is indicated in the package. Also, check if the package is well packed and it is well sealed and there are no holes in it. Okay, this one is properly sealed and packaged. And then after that, for the performance, if prior to doing the procedure or the treatment on the patient, first introduce yourself to the patient and then verify the patient's identity, and then discuss or explain what is the procedure you will be doing to the patient, why is it necessary, and how the patient can cooperate with you. And then after that, perform hand hygiene and observe for any other infection control procedure. And then provide for the client's privacy. If you are or if the patient is in a bed or in a ward, close the curtains around the bed to provide privacy, or if you are in a private room, close the door of the room if possible. We will proceed to the proper gloving. First, open the outer wrapper of the glove and place the inner glove package on a clean, dry surface. And then, open the inner glove package so that the cuff of the gloves are closest to you. And then carefully open the flaps of the package so that they do not fold back over and contaminate the sterile gloves. After that, place or put the first glove on your dominant hand. Grasp the inner surface of the glove for the dominant hand by lifting the inner or the folded cuff edge with your thumb and your forefinger, and use that and do the procedure using your non-dominant hand. And then slide your hand into the glove and keep your hands and fingers away from your body and above your waist level. Then, after putting the first glove on the dominant hand, put the second glove on your non-dominant hand. First, pick up the glove or the other glove using your sterile gloved hand by inserting the fingers or your fingers under the folded cuff of the other glove. And then after that, lift the glove up and away from the table and away from your body. And then slide your non-dominant hand into the glove and be careful and avoid to have a contact with your gloved hand. And then after placing both gloves on your dominant and non-dominant hand, adjust the gloves so that it would perfectly fit your fingers. If necessary, pull the fingers of the glove so that there are no excess at the fingertips. Then after doing that, keep both hands or both gloved hands between your shoulder and at the waist level in front of you. And then, if you're done with the performance of the procedure, remove and discard the used glove. And there is no special technique in removing the gloves. If the glove is soiled with secretion, remove it by turning it inside and out. And then, after doing that, perform hand hygiene. And the other one. And then discard it. And then perform hand hygiene. And then document that a sterile technique was used during the performance of the said procedure. Now, for the evaluation, conduct any follow-up indicated during the care of your client and ensure that there is an adequate number and type of sterile supplies or gloves for the next healthcare provider. That's all. Thank you.